Hello. Today I want to talk to you about the mask. We certainly have seen a lot of controversy, a lot of discussion in the last 7 days about the mask. And the good news is that Dr. Fauci has come forward and said, great news, we can change some of the mask wearing requirements because he's seen so many people get vaccinated. And so the mask rules apply to those people who indeed have been vaccinated. If you haven't been vaccinated, then the recommendation is still the same. You must wear the mask. Indoors, outdoors, doesn't matter. You still have to wear the mask. The other challenge is that the governor has indicated that he wants to hold for New Jersey before he says that he is ready to adopt the removal of the mask indoors. He has said you can certainly on the outdoors make sure that you continue to do all the things you usually do, social distance, hand wash, be aware of your surroundings. But the most important element of this is vaccination. And there is no way to tell whether or not you're with somebody who has been vaccinated or not, except the honor system. And so that's sort of the confusion that's going on. I think there's lots of discussions. We'll continue to stay on top of them. In a healthcare facility, you're still going to be obligated to wear it. We believe that this is the right thing to do for the protection of our patients, obviously, but also for the protection of our employees as we move forward. You know that 12-year-olds and above were authorized this week, and we were so thrilled that Dr. Bajpai, one of our cardiologists, was just all over it to make sure she could get her son in. And Driss, her 12-year-old son, was one of the first people that we vaccinated, and we were so thrilled to do it and so grateful to them for allowing us to tell their story, because I think it's important. And I want to be clear, there is no virus in the Pfizer vaccine, which has been authorized to be able to provide for kids 12 and above. So you don't have to worry about that. And as we've talked about, well, I'm worried about, what happens about the long-term implications. What we know is there are children who have developed multiple symptom syndrome from getting COVID. And the risk of that weighed against giving them the vaccine if you're over 12 years old. And remember, the studies are going on now for kids under 12. So we're hoping that that is going to happen in the fall as well. The research will prove it. That's also part of the mask issue, is just trying to make sure that we're still very much aware that this virus is still very present in everything we're doing. 90,000 doses have been given by our Inspira team. We are so proud of that work. We've partnered with schools, we've partnered with local businesses, we're partnering in faith-based communities. Wherever it takes is where we will go, because it's that important that we move forward. So I'm putting up the new hours on the screen now, so you can see that we've changed both our Mullica Hill and Vineland sites hours. We are still scheduling appointments, but we're also taking walk-ups too. So whatever it works, we're trying to accommodate to make sure we get there. Another example of how just the technology has brought us to new places is around the areas of minimally invasive surgery, often known as robotic surgery. Jonathan Lotek, one of our patients, shared his story with us. He had an abdominal hernia, and he met with Dr. Chang, one of our surgeons, and she and he walked through all the options, the pros, the cons, why minimally invasive would allow him to heal faster and get him back on his feet. And he really felt like there was a partnership, an active participant in this decision to be able to make sure that he made the right decision for himself. And so we're excited to have partnered with him on that, and most importantly, excited that Dr. Chang was able to allay his fears and get him in to take care of that surgery that he needed so desperately and make sure his pain was indeed over. As we talk about pain, there certainly has been a tremendous amount of pain in reference to the people in India. I know you've seen the footage that I've seen, people in the streets unable to get the care that they need. And we've partnered with the Department of Health and New Jersey Hospital Association to be able to use our extra resources that we have that we are not making use of, and we know we indeed can share with them. PPE and some face masks, some cannulizers and respirators that we are not using and that we know that we will be able to provide to them. And I know that other colleagues throughout the state are doing the same as we try and address just the tragedy that is happening there. As we move forward, we are going to continue to be asked to pivot. Pivot on mask wearing, pivot on how we deliver vaccines, pivot on the countries we help. And I think that's probably the most important message. We're here for you. Whatever it takes, whatever's required of us, we indeed are going to be there. And one of the things that's been required of us is really trying to look at our mental health services and make sure that they're available for all of you. sometimes you just need to be able to reach out and know somebody's going to be on the other end of that phone. And we are on the other end of that. Please feel free to call 1-800-INSPIRA, and we'll route you to the right people that you need to speak with to see how to get you or your family members or people that you care about help, because that's what we do. We're your partner in this journey of life, the journey of health, and the journey of community. Until we meet again, be well and stay safe. Thank you.